It was just, that was all that, because we have people on the phone and we're trying to keep it as brief as possible because.
Slightly counterintuitive.
No, yeah, it is. So there must be some process where people are sort of mentally triaging,
Yes.
where they're saying, okay, if they're already sick, and then the next option is patients most likely to recover, they're weighing in favor of that as opposed to the sickest patients. So again, lots of food for thought. Our third overarching theme is restrictive measures. So here's how we sort of set the stage for them. The use of restrictive measures is an important tool in the control of infectious disease. Yet these measures, such as quarantine, social distancing, and so-called snow days, can impose heavy burdens on those affected. In the context of a public health crisis, the state has the authority to override individual liberties, but also the obligation to minimize the unintended consequences. Our specific research goal here, to get an answer to this question: how are individual rights and liberties best balanced also with consideration of the greater public good? So again, we put some questions to people on the phone, ask them to what extent do you agree or disagree with each of these statements. So it is reasonable for government to have the power to order quarantine and to suspend other rights, like freedom of movement or... What percentage do you think of our 500 good Canadians agreed with this statement, that it is reasonable for governments to quarantine people? 80%? 80%? 85? Let's have a look. 85.
Ooh.
Terrific. You're right on. So 85% agreed or in some cases strongly agreed with that statement. So obviously Canadians believe in the value of quarantine, to give the government overwhelming authority to make those orders. So what about people who don't agree with their own individual? So sometimes it's easier to say, sure, in theory the state should have the power to do that, but then when it comes to themselves being ordered into quarantine, they may have a different view. So people who don't agree with their quarantine order should be able to ask the government to review. So it's sort of an appeal process. What percentage do you think agreed with this? So 85% agreed in principle with quarantine. What percentage would agree with an appeal process? 70, so somewhat lower. Pretty close, 62. 62 and 29% disagreed. So it's sort of an indication that they have pretty strong feelings that people that are ordered into quarantine, they're being put there for a reason, and they should probably remain there. Here's a question that was actually asked on another survey, and we thought it was a very interesting question, so we borrowed it and included it on our survey. So we asked people, trying to get a feel for what they think breaking quarantine would actually be most like. What's it akin to? And we gave them this list. Is breaking quarantine like parking in a no parking zone? Is it like driving faster than the speed limit on a busy street? Is it like physical assault? Or is it actually like manslaughter? What do you think people said? Which one do you think was rated highest as closest to breaking quarantine? Physical assault? Any other guesses? People are nodding with physical assault. Actually, 50% said that breaking quarantine is like manslaughter. So people have very strong feelings. Of course, this survey was done in the context of all of the hubbub about pandemic influenza. So the numbers might be somewhat different today because there isn't as much talk about the pandemic anymore. Although technically the pandemic is still underway, it hasn't been declared over. But we were somewhat struck by that, 50%. So our last ethical issue, of course, pandemics are by their very nature global issues. So we wanted to include some items about this. Pandemic preparedness and response calls for international cooperation. Poorer countries will be less able to protect their citizens than wealthier countries. Cooperation between richer and poorer countries may help to stop or slow down the spread of the disease. Our specific research question here: what is Canada's global role in an influenza pandemic?